at Bonner County EMS is extremely high. We hire and retain very good paramedics here. Our quality control makes sure of that. The quality assurance process at many other agencies is a punitive process, which we don't believe leads to an improvement in patient care. At Bonner County EMS, we approach quality improvement and assurance with education rather than punishment, and so we see a much greater compliance with our providers as a result. The name of our quality assurance program is called CRAM, Clinical Review and Mentoring, and it encompasses several things. First, of course, quality improvement, quality control. We read through charts and make sure there aren't any major protocol deviations. Secondly, CRAM also deals with the precepting of newly hired and advancing providers in a consistent manner. We evaluate their progress through their orientation. We also use our CRAM process to critically review new ideas. Whenever a vendor comes in with the newest, latest and greatest invention, we use the test of evidence-based medicine. If there's no evidence that this is the latest and greatest invention and won't benefit the county, then we say no thanks. Many other agencies use an FTO model, a field training officer model, where a newly hired or advancing provider is placed with one person for 3-6 months, however long it takes for them to get cleared. We take a little bit different approach, whereas we have one main mentor that stays with that person and oversees their progress, but that candidate is working with a variety of different preceptors. Whoever's on that shift is their preceptor that day. That allows that candidate to get a more diverse experience and acclimate to our system, I believe, much faster. At Bonner County, we've turned the entire system into a giant think tank. So any provider can come up with an idea for a way to do something better and bring that to the CRAM committee, and it's critically evaluated. And if that actually is a benefit to the system, then we proceed forward with it. Our medical director is Dr. Jenkins, and he specializes in cardiology. He's a cardiologist. So we've been able to stay at the forefront of emergency STEMI care, for example. We have a very progressive protocol for handling patients who have these STEMIs, that's ST, elevation, myocardial infarction, a heart attack in its simplest terms. The challenges that a Bonner County EMS paramedic faces are much different than the challenges that a big city paramedic might face. We have much longer transport times. We're with the patient for maybe hours in extreme cases. And so a paramedic at Bonner County must be much more familiar with the total continuity of care. Every month we have a case reviews meeting where we bring really educational cases that have happened over the past month or two to a round table where that provider who ran that call presents it and has the opportunity to share their experiences with the rest of the providers at Bonner County EMS and receive feedback from the doctor. Personally, I'm constantly learning. I don't ever want to be in the mindset that I've now reached the top of the mountain and I now know it all, because medicine is constantly evolving and there's always more to learn. Especially being a rural paramedic, you can't stop learning.